Hi Pierre,
Hi.
this is Joticanda. Welcome.
Yes.
I hope you have no trouble finding us.
Well, Reverend, I found the place easily. Thank you.
That's great. It's good to have you here today, Pierre. How are you feeling now?
To be honest, I'm a bit nervous because this is all new to me.
Okay, I see. It's understandable to feel your way. We will take things at your own pace, so don't worry. I want you to feel comfortable opening up. And let's start by discussing the reason for the referral. Well, your case manager, Sam, provided me with your individualized plan here, some information about your situation. Can you tell me more about what's been going on?
Yeah, sure. Well, about 9 months ago, I was involved in a hostage situation, and since then, I've been struggling with post-traumatic stress disorder, and Sam has been helping me coordinate with support services, including medication and sessions with a psychologist. But beyond that, I've been dealing with a long-term anxiety and social phobia. And it's affecting my relationship and my job.
Wow, seems you have been through a lot. And how is your social anxiety impacting your daily life?
Well, I just feel anxious in social situations, especially when I'm the center of attention or have to engage with new people. And avoid social gatherings, even simple interactions like talking to my colleagues also stress me out.
Wow, that must be really challenging. How does it affect your work specifically?
I am a web developer and deadlines are a big part of my job. When I'm under pressure, my anxiety worsens and I feel that my performance is suffering. I think improving my time management skills would reduce that stress.
Yeah, I truly appreciate your openness. Well, it's great that you are seeking help to address these issues. I want to ensure that our approach will align with your needs and preferences as well. So, well, based on your individualized plan here, there are few areas we could focus on, such as addressing social anxiety through cognitive behavioral techniques, developing stress management strategies, as well as improving time management skills. How does that sound to you?
Yes, actually, those areas cover everything that I'm struggling with. And I'm on board with this plan.
Excellent. Let's talk a bit more about your preferences. For example, cognitive behavioral therapy or CBT quite effective for social anxiety. Have you heard of CBT before? And what are your thoughts on this?
Well, I have heard about CBT, but I'm not familiar with it. But I'm open to try it if it can help with my social anxiety.
Sure. Yeah, CBT focuses on changing the patterns of thinking and behavior that contribute to your anxiety. And therefore, we can work together, identifying some negative thought patterns and then gradually exposing you to social situations in some controlled environment. This way you can build up your confidence and reduce the anxiety over time. How does the approach sound to you?
Well, that sounds promising, Reverend. I'm willing to try CBT. Can you give me an example?
Of course, yeah. Let's take a common scenario where you might feel anxious, like a social event at work. Well, during CBT, we would first identify the specific negative thought in that situation. Now, can you recall some thoughts of your case?
Hmm. I remember thinking that everyone is judging me or I don't belong here.
Hmm. Wow, I see. Hmm. So the next step, we can work on challenging those thoughts. We could ask ourselves, what evidence do I have when everyone is judging me? Or is there a more balanced way to look at this situation? This helps us see that, well, our thoughts are not always based on reality.
Yeah, that I could see. So it's about questioning these negative thoughts.
Yeah, exactly. And also, behavioral techniques can include, well, gradual exposure. You know, we could create a hierarchy of social situations causing you anxiety. Then we start with the least anxiety-provoking situations and gradually working up to the most challenging. You would practice facing this situation in a controllable and supportive environment, like some small gatherings when you are simply talking to your colleagues. This helps reduce anxiety over time.
Yes, that makes sense. I think I will learn this technique with your further instruction.
Oh, certainly. We will practice this technique through our upcoming counseling sessions. And also, we can incorporate stress management strategies and time management skills into the sessions as well. Oh, this will help improve your overall productivity. And now, Pierre, are there any techniques or activities you find helpful in managing your stress?
Well, I find that deep breathing and meditation really helpful.
Yeah.
But I struggle to maintain a regular practice.
Oh, yeah, I see. Oh, well, meditation and deep breathing are excellent tools to be integrated into our sessions. And, well, in addition to supporting your practice, we can create a routine program or a routine a schedule that fits yours. And alongside with this, I think maybe some stress management activities could be explored in order to find what works best for you. How does that sound?
Yes, that sounds good to me. And I think having a routine will be really helpful for me.
Yeah, yeah, sure. Okay, I believe now we can summarize our plan together. Mm.
Yes.
So, for our upcoming sessions, we will focus on CBT to address the social anxiety, integrate stress management techniques like deep breathing and meditation, and then work on time management skills to help you handle with deadlines more productively and effectively. Uh, Also, we can review our progress regularly and adjust as needed. How do you feel about this plan?
Well, I feel encouraged and ready to start working on these strategies.
Wonderful. That's great to hear. Well, Pierre, your commitment and willingness to try new approaches are crucial for our progress. Did you have any other concerns or preference for today?
Actually, no. I think we covered everything important, and I'm really looking forward to our next session.
Oh, yeah, I'm glad to hear that, Pierre. And now, before we wrap up, your case note with Sam here indicates that you've given consent to your mother, Rima, to be involved in all aspects of your individualized plan and relating support activities. Is that correct?
Yes, that's correct. I think having her involved will be really helpful.
Yeah, that's great to hear. Having Well, a supportive family member involved could make significant difference. So, okay, as you move forward, we will ensure that Rima is included in the planning and support activities. And I hope.
Yes, thank you, Reverend. I appreciate that.
Wonderful. And you're very welcome, Pierre. Your input and feedback are important, so feel free to share your thoughts and experiences. I look forward to working with you. Until next time, take care.